what can happen here, and this is pretty interesting, that if you feel like you haven't been able to express yourself, that can be locked up in areas of the throat. It can also be locked up in areas of the oral band and the face. You may have biting issues where your jaw may not be aligned properly. What's really important to understand is that any jaw issues are intimately related to the upper cervical spine. So my occiput, which is the highest bone in my cervical spine, and the top bone, the atlas and the axis, so the top 3 areas of the spine, intimately related to the jaw. Those areas are specifically in charge of head and neck rotation. So if I have issues with that head and neck rotation, even working on the jaw and the oral band may loosen this up a bit. So simple enough, you can open your jaw and relax the mouth here a little bit and start to work into, you'll feel if you open the jaw here, you can feel where this actual joint, the jaw goes into the skull here and opens up, and you can start massaging there and you'll feel some real tightness, and you follow the line of the jaw. This can be pretty painful, especially working on yourself, but you know, it's like trying to tickle yourself is hard. So you don't want to push, you know, you're not going to be able to push past that level of pain, but you do want to work into the muscles. You can use the tips of your fingers here in a circular fashion or in a linear fashion, and then work all along the line of the jaw here, even in the chin and around the top of the mouth here, all on these areas. You'll find this just feels so good. Now, your chewing muscles also come up into the side of the skull, so you can work into the temples here with a circular movement and using the finger pads here into the side of the skull, where these are in charge of chewing and speaking. Lastly, in this band, I like to work on the ears. So you can actually just squeeze your ears. You can stretch on them a little bit. And sometimes you may even get a little pop in the ears, and that's okay. Again, if you do have ear infections, things like that, I would avoid doing those at that point.